We're ready? We're ready?
Yes.
Okay. Welcome to Supervising Students with Disabilities, Raising Awareness and Cultural Competence webinar, presented by Dr. Rebecca Wilbur and Dr. Angela Kimmel. My name is Abiola Dipulu. I will be moderating the presentation today. The webinar is designed, implemented, and supported by the Society of Counseling Psychologists and Section on Training and Supervision of the American Psychological Association. The format for the webinar is that we have 45 minutes of content and 15 minutes of question and answer. Please submit your question via Zoom. Note that while we will not be able to address all questions, but we will do our very best. We will try to group similar questions together and invite our presenter to respond to major themes. Our CE policies and procedure are as follows. You must register and view the webinar via computer or laptop so that we can track your attendance to earn CER. You must also be present the entire hour. We are only approved to provide CE to psychologists at this time. We would like your feedback. Therefore, we'd like everyone to complete the online evaluation form for the webinar. The evaluation survey will be sent within 2 days of the webinar, so please check your email often. You must complete the evaluation and the brief survey that follows it that requests demographic information to receive CE credit for the webinar. The CE certificate will be emailed to you in about 4 weeks of the webinar. This will actually give you a 2-week period to complete the evaluation. For questions about CEs, please contact Dr. Ferdinand at the email address provided on the promotional flyer. Now, let us begin. But first, Dr. Wilbur, who is one of our presenters, is a licensed psychologist with specialized training in neuropsychology and rehabilitation psychology. She currently works at Legacy Good Samaritan Medical Center in the Rehabilitation Institute of Oregon. Dr. Wilbur has been completing research and publishing and has presented nationally on this topic in an effort to raise awareness, advocate for, and support supervisors and psychology trainees with disabilities. She is the recipient of the 2016 prestigious Soneke Semgopto VA Research Award. Her co-presenter, Dr. Kimmel, is an early career rehabilitation psychologist in spinal cord injury and disorders, and she is the Assistant Director of Psychology, Training, and Education at the St. Louis Stoke Cleveland VA Medical Center. She actively pursues research in supervision of students with disability and is passionate about training future psychologists. Dr. Kimmel was honored with the American Board of Professional Psychologists Early Career Diversity Award for her contributions. I will now turn it over to our presenter for the presentation.
Thank you so much. So this is Angela Kimmel, and I just want to start out with a quick thank you to the section on supervision and training for hosting this webinar and inviting Rebecca and I to present. I also want to warn you, we are quite passionate about this topic. It's very near and dear to our hearts. So Rebecca and I identify as a psychologist with a visible disability and an invisible disability. So without further ado, these are the learning objectives: to understand the unique challenges and biopsychosocial concerns trainees with disabilities face, to identify common misperceptions that lead to discriminatory practices in psychology training, and describe strategies to reduce bias in supervisory practice. All right, so some basic background about disability. So according to the US Census, about 19% of the US population has a disability. This has been on the rise in recent years due to advances in medical treatment and treatment of chronic illnesses. So the Americans with Disabilities Act provides comprehensive civil rights protections for qualified individuals with disabilities, okay? So according to the ADA, a person with a disability is a person who has an impairment that substantially limits a major life activity, a record of some impairment, so for people with episodic disabilities, or someone who's regarded as having an impairment, like somebody who has facial disfiguration. It might not interfere with a major life activity, but they can be protected under the ADA from discrimination. So in 1990, when it was passed, major life activities included seeing, hearing, walking, caring for yourself, learning, breathing, and working. And then when the ADA was amended back in 2009, the definition of disability was broadened to include, but not limited to, performing manual tasks, eating, sleeping, standing, lifting, bending, speaking, reading, concentrating, thinking, and communicating, as well as the operation of several specified major bodily functions. So it's really only in the last like 10 years or so that individuals with many invisible disabilities could really get protection under the ADA. All right, so I want to clarify the real message and purpose of this lecture. This is essentially a diversity lecture. We perceive disability as a really important part of diversity. So thinking about how to raise your cultural awareness, you know, Daryl Wing Su's framework of developing knowledge, awareness, and skills. And the only way to do that is to really wrestle with these issues. So this lecture is really a starting point for that. And I also want to give a plug. Our colleague Erin Andrews just came out with a great book that's Disability as Diversity, Developing Cultural Competence. All right, so to start off, you need to think about how you view disability. So we like to start with the models of disability, okay? So there's 4 of them. The first one is the moral model, and that's really the oldest model of disability. It associates disability with sin and shame. It may or may not be based in religious doctrine. Disability is a burden, family shame, and it precludes a meaningful role in society. So like this is example like charity organizations who are using pity to get money for people with disabilities. The second one is the medical model. It came about with modern medicine, where disability is a failure of the bodily system and the focus is on the cure. This heavily influenced the public policy, Social Security disability, where people with disabilities can't work. This third model is the social model, and that is my personal favorite. So this is where disability is a neutral characteristic or attribute. There's not a problem with the individual or an impairment. It's a social construction. And the focus is on external barriers, such as physical obstacles to building access and attitudinal issues such as prejudice and discrimination. So this really came about with person first language after the Americans with Disabilities Act. And finally, the minority model of disability, where disability is a natural difference on the spectrum of diversity. It's a normal aspect of life, not a deviance, and it's a distinct cultural and socio-political experience and identity. Okay, and so this is really where the identity first language came up, where it's okay to refer to somebody as an amputee or a quadriplegic. All right, so a little bit about the social psychology of disability. So people always find it interesting that the most difficult challenges for people with disabilities involve the social stigma and discrimination, not the physical or mental challenges associated with the disability. Okay, so like for an example, one of our favorite ways to sort of like draw people's attention to the vast discrimination people with disabilities face is when people with disabilities who use wheelchairs fly. Oftentimes they arrive at their destination, their mobility equipment is broken, okay? So that's an example of inaccessible environment and discrimination, okay? So the cumulative effect of these negative attitudes are referred to as microaggressions, and they lead to the oppression of people with disabilities. And then something to keep in mind is that psychologists themselves are not immune to biases and discriminatory prejudice towards people with disabilities. Now, we're going to add this mix of stigma and discrimination, and how does that apply to training and supervision? All right, so one of the things that I wanted to sort of bring to everyone's attention is a little bit about counseling psychology and trainees with disabilities. So despite the fact that disability is a part of diversity and people with disability experience discrimination and marginalization, disability is not a focal point of the counseling psychology literature. In fact, a study that looked at 20 years of counseling psychology literature found that only 1 to 2.7% in a 20-year period focused on disability. So one of the reasons we were so excited to be here today is because university counseling centers had the highest reported rates of interns with disabilities from APA, COA, the annual report data that's reported to COA, okay? So we've done some thinking about why this might be, and the two theories that we have, and we're totally interested to hear your ideas too, is that students with disabilities are attracted to counseling centers because they're part of the university and it could be easier to get accommodations for training. And then the second theory we have is how counseling psychology has the value of social justice and multiculturalism. But we are also open to other ideas and are interested in hearing your thoughts. All right, now, so something that's very unfortunate is that people with disabilities are very underrepresented in psychology. So I want to encourage everyone to go read on your own the Callahan article from TEP in 2018. These are the rates of active psychologists from the APA workforce data. And so you can see active psychologists, and then you can see the diversity groups by rates, broken down by ethnicity. Disability is by far the lowest, okay? The other thing, if you look at the chart on the right, every diversity group, we've got disability, ethnic minorities, and then we've got LGBT. Every minority group in psychology has increased over the past few years, over the decades, except disability. So if you look at this, and something we want you to remember, disability reached its peak in the 1980s. And something that we always say is, who wants the 80s to be their best decade? Okay, so, you know, it's really unfortunate that even with the passing of the ADA, that people with disabilities in psychology have decreased. Now, what this says to me is that there are still way too many barriers that exist. All right, so let's talk a little bit about the literature. And for this talk, we're really focusing on the biases and the discrimination. So some of the earliest literature on supervision of students with disabilities, done by Rhoda Olkin in her landmark book back in 1999, is that clinical supervision is the worst part of training in psychology for students with disabilities. And this is because of the prejudicial and discriminatory behavior. So supervisees in her writing had to prove, they were sharing with her that they had to prove they could handle their disability in a clinically appropriate manner before they were ever allowed to see patients clinically. And Rhoda Olkin urged supervisors to give trainees with disabilities the same right to try to be good, lousy, or mediocre, just like anybody else. All right. Now, so the next really good piece of literature on this is the Lund, Andrews, and Holt article, and they surveyed students with disabilities and psychologists with disabilities in psychology, okay? They found that the influence of disability on training was significant. everything from selecting a graduate program to the courses to the career path, okay? The literature on trainees with disabilities shows that trainees are reporting concerning experiences of disability bias in their training and their supervisory relationships. So over 80% of trainees experience disability-related barriers from APA's data, and a third reported mixed or negative reactions upon disclosing their disability to faculty. So when we say visible versus invisible disability, so visible disability is any observable indication of functional limitation that impacts daily life and may include physical change to the body or use of assistive devices. Whereas invisible disability, also called non-apparent, is any condition, physical, mental, cognitive, that might not be discernible to the eye, but impacts functioning or leads to limitations in daily life. Now, so here's why this is important. So according to APIC data, the most commonly reported types of disabilities reported by trainees are chronic health conditions, learning disabilities, and mental illness. So if you look at that list for a second, I hope you realize that all those are invisible. All right, so the stereotypes that underlie disability biases in supervisory relationships. So I've got a list of both overly positive stereotypes that you might have about trainees with disabilities, ranging from, gosh, they're so resilient, they're courageous, they're a superhuman, to negative, where you might think, gosh, they're dependent, they need a lot of help, or maybe you see them as impaired or incompetent. So both of those lists of biases have negative, can both negatively impact trainees with disabilities, and we will talk more about that. Okay. All right, so I'm going to pass the microphone over to Rebecca.
Thank you. So how might these attitudinal barriers translate to barriers to training for trainees with disability? What does that actually look like? So I've kind of broken it down into kind of 4 main types that it could fall under, and kind of separated out a couple of examples that might fall for someone with visible disability or might be for someone with invisible disability. So physical types of barriers for someone with visible disability might be something like stairs with no ramp access, or no wheelchair accessible seating in lecture halls or other places of training. For invisible disability, it might be someone with like limited hand function is denied a proctor an ability to use dictation software when required to do some lengthy written test. Programmatic barriers for someone with visible disability might look like something like a trainee with tetraplegia and reduced hand function is barred access to training due to needing alternate test administration strategies. And instead of finding different types of reasonable accommodations to allow the trainee with visible disability the opportunity to participate in that training site, they're barred from being able to participate. For someone with invisible disability, this might look like requiring trainees to disclose disability out of a concern that a therapist with a disability is somehow inherently harmful to clients and violates their informed consent, which really promotes a very negative view that something is inherently wrong with someone with disability. Systemic barriers for someone with visible disability might include something like inaccessible forms for someone who's visually impaired or for visually impaired applicants. For invisible disability, this could include requiring persons with invisible disabilities extra forms and documentation to prove that disability exists, which results in delays in processing the documentation and then actually being able to get to or have access to reasonable accommodations. Attitudinal barriers, which is often the most cited for someone with visible disability might be something like an assumption that a person with spinal cord injury or a wheelchair user is intellectually disabled or is unable to learn or unable to behave in a professional manner. For someone with invisible disability, this might be the assumption that using reasonable accommodations excuses trainees from developing proficiencies, and therefore using reasonable accommodations would produce an incompetent professional. As I noted, attitudinal barriers are often the most cited and could also include things like asking a trainee how they acquired their disability, or asking trainees to cite policies or law, or estimate the cost to their program about how to establish accommodations, or requiring the trainee to disclose having a disability, which not only violates the trainee's policy, but it promotes a view that disability is somehow inadequate or harmful in some way. Next slide, please. So, but why is this a problem? We have the Americans with Disabilities Act. It's 30 years old as of this year. So often the question becomes, so students just need to disclose to get accommodations and then everything will be fine, right? Well, it's actually a little bit more complex than that. What really seems to be missing from this kind of statement is a lack of understanding that persons with disability experience bias and discrimination. And if a trainee has a non-apparent or invisible disability, then they have to disclose in order to access accommodations. But once a person discloses, it really opens them up to experiencing more bias and negative attitudes. So disclosure can be really difficult. And that's if the student recognizes that their situation is disability related, especially for students with invisible disability, which again is the largest number of students with disabilities. And it's more likely that supervisors will have a student with invisible disability. But sometimes students with invisible disability may not have realized or recognized that disability is a part of the picture. And why not? Why wouldn't a trainee with invisible disability realize that they have a disability to begin with? Well, there's a general misperception that unless you can see it, it must not exist. Which brings me to my next slide, identity. So there are some challenges, particularly for trainees with invisible disability, with identifying with having disability. So the quote on this slide refers to a study that was performed by Cortez et al. That looked at upper arm, or students with upper arm weakness or dysfunction, and their ability to access the library resources on their college campuses. And the finding was that the trainees with upper arm weakness or dysfunction were not able to access library resources equitably as other students. And this ended up creating a lot of barriers to them, that they're not being able to access all of the library resources. And a remarkable quote from one of the student participants was, "Yeah, it's been really difficult. It's like having an invisible disability." But the thing is, it is having an invisible disability. So even in circumstances where the student recognizes that there's a barrier that may be linked to a condition that they have, they may not have ever heard of the term invisible disability or recognize that what they are experiencing is part of the disability cultural experience. So my next slide, disability, identity, and disclosure. So the problem with the assumption that students just need to disclose and everything will be fine is that identity and disclosure are very complex. So trainees have to disclose in order to receive accommodations. However, we've noted that once a person discloses, you're going to experience more discrimination bias. In the article that we noted earlier, over 80% of trainees with disabilities experienced negative attitudes. So the trainee may also not be aware or recognize that they have a disability. So accommodations are there to help level the playing field and offer disabled students the same opportunities as non-disabled students, but many may have too narrow a view of what disabled means. And so it may be that to identify with having disability, the perception is that a person is not able to do anything. Many people don't realize that it is on a continuum, that it is a range, that it involves all the things that Dr. Kimmel listed earlier that fall underneath the protections of the ADA, which can include things like even thinking or being able to process information. So we may have too narrow a view of what disabled means. And so students may have the idea of, well, I'm not bad enough off to have to use that. I'm not bad enough to have to use accommodations, which again, maybe relate to their own internalized disability bias. If they are aware that they may have a certain type of invisible disability, then they're in the position where they may be having to weigh the pros and cons of disclosure. Appearing to be like everybody else is safe, and deciding when and to whom to disclose to get their needs met, to be able to have access to the same resources and opportunities as non-disabled students would be good, because it may reduce harm and reduce the opportunity for aggravated symptoms. But knowing who is safe to disclose to and then how much of their information disclosed to may be daunting. Students may wonder about balancing how much to disclose and protecting their own privacy. So in the cartoon by Spaceboy Can't LOL that's listed on the right-hand side of this slide, it kind of creates a common experience for people with a type of invisible disability. So in this it says, how do we know if they're actually dead or just pretending? And the person on the right says, I have a chronic illness. And so all of a sudden, these people who are supposedly faking being dead suddenly have to give all these different recommendations for kale, yoga, essential oils. Everybody has an opinion for how to fix this person's chronic illness that they've been living with and dealing with. And so a lot of it is also dealing with a lot of the attitudes of, if you can't see it, then here's how you have to fix it. Or if you can't see it, it must not exist. Which leads me to questions and concerns around accommodations. So we've identified that identifying as having disability may be difficult, which makes disclosure difficult. And disclosure is hard because it opens one up to more discrimination. But there are also challenges related to accommodations as well. There are a lot of assumptions about accommodations, even from well-meaning and educated supervisors. So the quote above listed on this slide is one example from Mullins and Prade from 2013. They did a research study looking at social barriers for university students. And one of the students reported that when they asked for reasonable accommodations from their professor, they got a lot of negative attitude about it. The professor's attitude was, well, oh, you get extra time on a hard exam? Oh, aren't you so lucky? Which suggests that using reasonable accommodations gives the trainee some kind of a shortcut. And it's an assumption that using accommodations that many supervisors and professors may have is that using accommodations may lead to the underdevelopment or lack of development of the necessary skills of a psychologist. And that's really a key job of supervisors. We cannot let incompetent people practice. We have to do no harm. We have to protect the public. That's a foundational ethical principle. But that also ignores two really important facts. One is that the literature shows that trainees with disabilities actually commonly underutilize resources and accommodations, especially in professional settings. And that is attributed to the fact that trainees want to appear competent. They want to present as being able to do it just like everybody else, even if that means harm to them. The second is that reasonable accommodations are just that. They're reasonable. They are to level the playing field. The idea is that using reasonable accommodations diminishes learning. It is really a fundamental misunderstanding of what reasonable accommodations do. Another issue that we often see with supervisors is some rigid thinking in identifying what reasonable accommodations could involve. You know, we often assume that because our clinic, our institution, our job has done it this way, that it has to be done this way. But what we really need to do when the issue of disability or the need for reasonable accommodations comes up is really carefully consider what are the essential functions or qualifications or the essential duties of being a psychologist. Is it typing? Is it walking upstairs or walking long distances? Is it having 20/20 vision or perfect hearing? Those things really aren't essential functions of being a psychologist. And in order to allow students access to accommodations, we really have to broaden and question our worldview and raise awareness that trainees may have visible or invisible disabilities, and that allowing trainees to be able to demonstrate competent skill development is what's important. How they go about it is not the issue. The danger is if we don't keep in mind that trainees may have invisible or visible disabilities, is that we're more likely to assume that if a trainee is struggling, then it's an indication of incompetence or laziness. And when we do this, we inadvertently act on biases and screen out and make it impossible for otherwise qualified trainees to enter the field. And that's a problem because it reduces the diversity in our field, which in turn prevents that information to be disseminated to the public. It can help to change dogmatic cultures and provide good therapy services to the public. And we can never lose from having our worldview expanded. So, next slide, please. Challenges in accommodation needs. So, what other challenges may there be? So, it may be that students also don't know what to ask for. It may be that students who have been overcompensating without accommodations begin to struggle as the intensity of educational requirements increase. And they may not have recognized that it was disability that was interfering to begin with. Also, different training environments may lead to different accommodation needs. And a student may not know what they need to ask for until they're in that environment and see what they have access to and what they don't. And so the idea that students just need to disclose upfront and ask for the accommodations right away to get the accommodations immediately wherever they are really misses the fact that trainees may not know what to ask for, because part of the purpose of educational institutions and the intent of learning from practicum sites is to learn new things. And the trainee may not know what to ask for because they've never been in that environment before. There's also a perception that the trainee bears the largest responsibility for knowing what accommodations they need, citing policy and understanding accommodations, or knowing how their specific training site, whether that be their educational institution or different practicum placement sites, they have to know how the training sites go through the process of establishing accommodations. And that actually can be vastly different depending on each institution. Each institution may have their own equal opportunity officer and their own processes and forms for establishing accommodations that a person isn't going to know until they're there. And those factors, again, they may change depending on the location. And disability is not static. In the cases of fluctuating disabilities, there need to be fluctuating accommodations. So as disabilities may come and go, if it's a relapsing remitting kind of condition, or for example, pain or fatigue, which are not constant but fluctuate, or if a person changes medication regimens depending on their condition, the idea that a trainee has to disclose up front right away assumes that accommodations are going to be the same all the time. And we know that that's not true, because circumstances, environment, and disability changes. And so accommodations really need to be able to change and be flexible with them. Other concerns may include being perceived as less competent for using accommodations, something I mentioned earlier, or the perception that the trainee is lying about having a disability if they don't use them exactly the same way every time, even though we know that disabilities fluctuate. For example, a common disability among students with invisible or non-apparent disability may be having a learning disorder. A common accommodation may be testing in a separate room and having time and a half to complete the exam, which means that the student would have the typical amount of time for the exam plus half of that. So if a test is expected to take an hour, the accommodation would be an hour and a half. But what if the student doesn't need an hour and a half? What if they just need an extra 10 minutes to double check their work? Will they be perceived as lying if they don't use the accommodation exactly the way that it was written? And you know, when accommodations are not in place, students experience consequences. They struggle as a result of the disability and not having equal opportunity, which can be very frustrating to the supervisor to see a student struggle, and that may or may not be all of a sudden, but if they're not aware that disability is a factor. Which brings us to our next slide, who's on first? So, you know, what does all this mean for the supervisory relationship? We've concentrated on the student's perception, but what about the supervisors? So in this study that Angela and I did at the Cleveland VA, we looked at supervisors' awareness of disability and asked for their perception of who's responsible for establishing reasonable accommodations. The article was published last year and is titled "Who's on First?" to refer to the famous Abbott and Costello comedy sketch about the players on a baseball team. I'll go over this in greater detail, but essentially the article identified that there was a serious diffusion of responsibility in establishing reasonable accommodations for students. In general, supervisors were really confused about how to establish accommodations and disability-related concerns. So on this next slide, we can show you the results of supervisors' awareness and experience. The table on the left-hand side shows the rates of how supervisors rated themselves in how they felt about their level of competence in working with trainees with visible disability, which, as you can see, was over 90%, did not feel very competent. And for trainees with invisible disability was even higher, 91%. Then we also gave supervisors 2 vignettes that were exactly the same. They both described a trainee that had been doing well at their practicum site and now was experiencing some challenges. And then we asked them many different questions about who was responsible for establishing accommodations and how they would handle the situation. Again, both vignettes were exactly the same, but one vignette identified the trainee as being a lifetime wheelchair user, identifying them as having visible disability. The other one was actually based on a trainee with invisible disability. And everyone who participated in our study got one of the two vignettes randomly assigned. When we compared the supervisor's perception of who should be responsible for establishing accommodations, whether it was for visible disability or invisible disability, as you can see from this table, they rated everybody. They thought the student was responsible. They identified themselves as being responsible. They identified the equal opportunity officer at their institution as responsible. They identified the director of clinical training at the student's site, at the student's institutional setting as responsible. So that there was this diffusion of responsibility from the supervisors. It generally led to confusion and likely it created barriers to establishing accommodations. And in our next slide, discussion of recommendations, many supervisors lacked awareness about essential elements of supervising trainees with disabilities. And that may lead to bias in the supervisory relationship. And most supervisors were not aware that it is their primary role is to advocate, coordinate, and establish accommodations. And so we strongly advocate that training directors and psychology leaders seek opportunities to raise awareness about working with trainees with disabilities among their clinical supervisors on their staff.
All right, so let's talk a little bit about what biases influence the supervisory relationship. Well, so I presented the list of both positive and negative stereotypes earlier, and they both affect the supervisory relationship, okay? Also, just because you might feel unbiased towards one disability, it doesn't bar you from being biased towards another disability, okay? Now, so something we haven't talked about that I want to briefly mention is sometimes supervisors may become overly concerned about a disabled therapist's welfare or feel a sense of having to care for him or her. And that's what we're referring to as like countertransference. And then, we also got word trainees with disabilities shared their experiences with us that a supervisor may experience urges to treat a trainee like a child due to prejudices held. They're feeling very parental towards them. Okay, now, so how does the presence of a disability in a supervisee impact the authenticity and accuracy of feedback? So one of the sort of negative consequences of overly positive biases may prevent a trainee from getting positive feedback when a supervisor overlooks weaknesses or training gaps. Supervisors may also feel like they should have lowered expectations for trainees with disabilities. So whose responsibility is it to help the supervisor examine his or her attitudes about disability? Well, it is the supervisors. We encourage supervisors to engage in self-reflection, and there's a great article by Rhoda Olkin who asks you questions such as, how has the world informed you about disability? Do you believe a psychologist with vision impairment can be a psychologist? So it allows you to truly and carefully examine your own thoughts and feelings about disability, including different types of disabilities. And then the other thing we recommend is that you seek consultation. All right, so the supervisor's role in disclosure, okay? So supervisors really have to provide a safe place for students with disabilities to disclose, okay? As we've talked about, it can be very hard, especially if they have to recognize what they have is disability and then feel safe enough or feel it's important or worth it to disclose it, okay? We found out through our research, supervisors said, hey, when students disclose, it's beneficial to our relationship. If students don't disclose, remember, you can highlight disability as part of diversity. And then even if you do everything, provide a safe space to disclose, if you ask everyone if they need disability accommodations, there's no guarantee that the student is going to disclose. Okay.
So other accommodation challenges. So how can a supervisor communicate openness and recommend accommodations to a supervisee with a disability who has not requested them or doesn't want them? So one thing would be trying to understand some of the contributing factors. Is this a disability identity issue? Does the student not recognize themselves that this falls under the ADA? And if that's the case, being able to pose having disability, again, as not being a character flaw is something that's recommended. You know, understanding, is it an accommodation issue? So a supervisor could reframe accommodations as just routine ways of maximizing the chances of success. It may be related to the student's internalized disability bias. And in that case, a supervisor is in a position to model respect for and supporting disability. It's important to note that the supervisor can ask questions that about whether the challenge might be related to disability, but they cannot ask directly what the disability is. So solutions to ensure, sorry, next slide, please. Thank you. To ensure accommodations are received and utilized, offer assistance and be an advocate. We really encourage everybody to try to be understanding of the reality of being a maturing professional with a disability. And we've included multiple references at the end of this presentation for further reading and learning about some of these issues. Again, this was kind of an introductory lecture. Again, reframe how accommodations are perceived. And we really encourage supervisors to take a problem-solving rather than disciplinary approach. The supportive supervisor really tries to focus on the supports that are needed to be successful. Again, trainees do have to demonstrate that they're able to exhibit the professional essential qualities of being a psychologist, but how they go about that, how they demonstrate that they have reached competency is less of the issue. It's more important that they do reach those competencies. So next slide, please. So the ultimate goal that we're encouraging everyone to reach is developing a disability affirming training environment, or what we refer to as a DATE, which is an environment of attitudinal awareness of disability culture and identity development, and taking a strengths-based approach towards disability. Its willingness to advocate for disability rights, such as universal access, and dedication to establishing accommodations for trainees. Next slide, please. So developing a disability training environment. So again, as we mentioned earlier, really we encourage everybody to examine your own thoughts and feelings about disability, including different types of disability, that knowledge, awareness, and skills. Now wrestle with that. So a lot of it is self-exploration, continuing education, and consultation. Be willing to have difficult conversations when this comes up and when we may not know. It may be a new experience for us as supervisors, and if we put a foot wrong. Consider that supervision also invites opportunities for professional growth and learning on the part of the supervisor. So knowing the accommodations process at your institution is also really crucial, because it is very different institution for institution. Also, we really encourage supervisors to provide a safe place for students to disclose. We encourage supervisors to talk to every trainee about the fact that as your supervisor, if at any point you ever needed reasonable accommodations, I would be the one to help you to put those into place. And it's possible that anyone at any time could develop the need for an accommodation, even if it was something as simple as the person broke their leg and they weren't able to ambulate the way that they typically would. They may need accommodations for a period of time due to being slowed down. So really, supervisors need to be advocates for students. Again, we say talk to everyone about accommodations, open the door, but don't ask everyone if they have a disability. That question is technically illegal. It's important that you, in the beginning, identify your role as a supervisor and facilitator in navigating the new environment to establish accommodations. So if you are eager to learn more, we have a pre-conference workshop at the upcoming Counseling Psychology Conference. And we will also be presenting information specific to accommodation challenges at APIC in San Diego on May 2nd. And we also encourage everybody to join Division 17 on their section on supervision and training. And we've also included additional relevant references, again, at the end of the presentation that may be useful for further education. So thank you all very, very much for attending. We'll take any questions.
Okay, so.
Okay. Question. Oh, let's see what question you have. Can you see the question?
Yeah, so I'm bringing up, wow, we've got like 17 open questions. I'm really glad that people have.
What we can do is to group them together and have you respond to the themes.
Okay. Okay, and it is, I will say, the #1 question we get asked, which doesn't make this format very easy. And so, you know, feel free to contact us individually, only because the #1 question we get asked is, I have a student with a specific disability and we had this issue. Rebecca and I do consulting on a national level. And so we're happy to consult with you individually on some of these issues, because we've got questions on specific disabilities here.
Okay.
So here's an interesting one, and I know, Rebecca, you wanted to talk about this. Is there a resource for understanding what reasonable accommodations can include? Sometimes we get requests that are challenging in a mental health training facility, such as an accommodation to not participate in group activities or assignments.
That's a really great one. Again, I think it's multifactorial. It's kind of looking at if it's a group assignment, what maybe, you know, what is the barrier to being able to participate in that? It could be related to something like anxiety or something of that nature. And again, it's more about understanding what are the essential functions of the psychologist? What is the purpose of developing this particular criteria for the class or for the site? And so really kind of distilling it down into what is the actual competency that you're trying to get them to learn. Is it working well with others? Is there some other way that can be demonstrated? We also recommend that folks take a look at the Job Accommodation Network, which is part of the National Association on Disability. And there is many different resources there that you can actually search for a particular type of disability, and it will come up with all kinds of different printouts that offer different types of reasonable accommodations depending on what the challenge may be. And so that's a really great resource to refer to be able to get an idea of what accommodations might be out there, what might be available depending on what the disability may be related to.
Yeah, so one other question that I want to bring up that's really good. So someone is asking for clarification about the supervisor's responsibility. So we were advised by APIC that everything must come from the student and his or her medical providers to avoid potential lawsuits by other students that could be perceived as having been treated unfairly. So something that I want to emphasize is we are encouraging you to ask every student, if you're a director of training, when you meet, once the training, like once they've secured the placement, say, hey, do you need disability accommodations? So that's something, so if you ask everybody that question, you're normalizing accommodations, you're decreasing stigma around disability. And yes, everything the student does have to request, they have to answer your question if they need accommodations, but we encourage all supervisors to ask everyone.
Or at least bring it up in conversation, even if you don't frame it necessarily as a question. But just identifying yourself, bring up disability and accommodations right at the beginning. That demonstrates an openness to disability and seeking reasonable accommodations in your institution. So again, saying something like, by the way, if at any point you ever needed reasonable accommodations, I would be the one to help you secure those. And so again, we're trying to help supervisors develop more awareness and then openness about disability and seeking reasonable accommodations at their site.
Right. So one other question I'm going to bring up, only because I know that this is a really hard topic. So Rebecca, we've got someone else, and our question list is now up to 27.
Wow.
Provide more specific examples of how to open up the door of conversation with students so that they might be open to discussing disability.
Angela, did you want me to take that first?
Sure.
I think that's a great question. There's lots of different ways to be able to do that. I think a lot of it is developing that disability affirming training environment. And so it's really creating, in some ways, a culture change where you are by bringing up that you'd be the one to establish accommodations early in the supervisory relationship. You can develop different didactics and training at your site that cover disability, that review maybe some of the articles that we've included here in the resource list. Again, hiring other supervisors and professionals at your site, if that's something that you have access to doing, or promoting that within your site. Providing focus on other, or celebrating the work of other psychologists with disabilities, but again, making disability more visible, making that something that you are wanting and celebrating in your institution and in your workspace is one of the biggest things that you can do to help facilitate trainees knowing that this may be a safe space.
Right. One other thing that I'm going to add, so one of my mentors, Linda Mona, has a wonderful quote that she shared with me. So sometimes it can be frustrating if a student doesn't disclose disability and they're not requesting accommodations. Linda says sometimes when she's caught in that situation, she will say, if we don't do something, your brilliance as a psychologist won't be recognized. Okay, to just help the student. So what I like about that line is she's recognizing the student's strengths, and she's wanting to set them up with skills that are going to help them succeed. So I really, really like that line. Okay, so we have a specific, so we do have certain questions about specific disabilities, and I don't think Rebecca and I put our emails on this presentation, believe it or not. So I want to just give out our emails before we lose everybody. So contact us with more specific questions. And we, like I said, like sometimes we get the best examples that we use in future presentations from people who come up to us and say, hey, I had a student with a mental health disability, and this was the struggle we had. So please, I want to encourage people to reach out. So my email is angelakuemmel@gmail.com. So please feel free to track me down with specific questions, because as you see, we have upcoming presentations, and we'll definitely, the questions that you guys asked today that we didn't get to were really good and gave us good food for thought.
Absolutely. And an easy email for me would be, it's essentially drRebeccaCWilbur@gmail.com, but it's dr.rebecca.c.wilbur@gmail.com, and that can be added. I will add that into the chat so that everyone may see that.
Oh, that's a great idea.
And it looks like Angela's, yours was added as well. So both have been added.
Wonderful.
So, please feel free to reach out to us. We really want to be able to offer any insight or assistance that we can.
So we also have a question to add our emails to the slides before we send them out.
Sure,
So
that can be done.
We're gonna do that because some people, had really specific questions that we have obviously run out of time. So I've given a lot of talks. I don't think I've ever had 30 questions and comments. So thank you so much for being a really engaged audience. And we hope that we can do more like this.
Yes, thank you all. Thank you.
Thank you. Wow. Dr. Wilbur and Dr. Kimmel for sharing your expertise with us today. There are so many wonderful takeaways. I mean, I think I can just mention one of them, which is, you really broaden our understanding of how we as counseling psychologists and other mental health professionals can better help training with disabilities. And I'd like to thank Dr. Ferdinand and Dr. Pence, for organizing this and the technological leadership. And I'd like to thank everyone for joining us today. If you'd like to continue the dialogue, you can go on to our listserv, STS listserv, or Division 17 listserv. We have another presentation coming on inadequate and harmful supervision. You will really like this. So stay tuned for the details. Again, I'd like to thank everyone for joining us today. That's